morning, good afternoon, and good evening, my dear vascular colleague. Today, I'm going to investigate and show you a new, very versatile teaching platform. The teaching platform has been developed by Dr. Mahmoud Al Ghadban. He is in charge of Sigvara's global marketing group. He has shown over the last few years enthusiasm for teaching, and he has developed a great platform that I have enjoyed all its activity, which is MOH, Medical Online Hub, which have given us a lot of good vascular knowledge and have shown us a lot of activity. So I would like to welcome Dr. Mahmoud Al Ghadban, dear colleague, and I thought it's a chance for two teaching platform to share their ideas and their activity. And let me start by the first question to Dr. Mahmoud. Where did the idea of medical online hub came from? Dr. Mahmoud.
Thanks so much, Professor Muhammad, for this nice word and kind introductions. Really appreciate it, and I really appreciate that we collaborate in all different platforms to make sure that knowledge and education is available, accessible to everyone, everywhere, at any time. And this is one of the main mission that we have from the MOH, and that's why we came up with such an idea that we would like to fill a gap, which we believe that we can, with our medical competencies in Sigvaris group, especially in the compression therapy, which is including in most of the veno-lymphatic disorders, that we can really help and add more in spreading the word and increasing the awareness and educations. So it's about helping and collaborating with global and regional medical communities, as well as bring people with experience together to share their knowledge and enlightening others via online events.
Excellent. So I come to the second question, which a lot of vascular surgeons ask me about. How MOH can help the medical community?
Yeah, I think this is a very good question, and I'm happy that it was raised from the medical community because that also helped us a lot to improve. The objective from the Medical Online Hub actually to provide a first-hand information, better understanding about different indications, and it offer a free access, as I said, that we are now crossing all the borders with free boundaries that the people can actually get access to all knowledge from different parts of the world. So we are not asking for subscriptions, we're not asking for submission of any fees or any documents. It's just open to serve and help the community that they can share the knowledge among each others easily accessible 24/7. And we actually trying to help with the in high level medical discussions, especially practical aspects. As you know, we have more than 150 years experience in the textile, plus also more than 60 years in medical compressions with a lot of studies. And also we have our own edema institute in Australia that helps us a lot to gain a lot of practical knowledge that we can share it with the experts. Yeah, so it's all a high relevant topics to the compression therapy, ulcer treatments. Even we are trying to involve different specialties. For example, there is some of areas that we can increase the awareness among the obstetrics and the gynecologist, among
Yes.
the dermatologists. Some of
Yes.
these specialties actually seeing a patient who actually has some vascular issues that we are trying to help them to understand the cases, and then they can refer their patient to the vascular doctors in their clinics.
Excellent. Very good. So I have seen the success of MOH from its start and how it is getting more and more popular. What do you think, Dr. Mahmoud, or you expect in the future this platform to offer to vascular colleagues?
Yeah. Yeah, for us, if I can talk about the near future, we are planning, for example, next year to have around 18 webinars. And these 18 webinars, it will not be only just recording videos, but also we'll get articles out of it. We'll get summaries for each presentations. We'll get also the result and discussion from the poll discussions and the questions, but also take home messages. And just to give you an idea, it will be in 6 different languages. So it's not only English, but also we'll have French, Portuguese, Spanish, even Indian and Japanese and Chinese.
I think we also discussed how we can, both of us as a teaching online platform dedicated to vascular surgeon and other specialties, that we can help each other, we can work together for the benefit of all vascular surgeons. So what is your idea, or how do you feel about collaboration between VOT and MOH?
Actually, as I said to you in the beginning, we get inspired with what you are doing with the Vote Vascular online training. I'm
Okay.
part of the Telegram channel. I'm part of the YouTube, following the YouTube channel, also the Facebook group, and I'm always impressed and fascinated with the eminent doctors that you have among these groups, sharing their knowledge and informations, different source of informations, different cases. It's really impressive what you are doing with the Vasco online training, and as I said, it is really inspiring us. And I'm sure there is so many ways of collaborations. Sharing also is caring, as we always say. So we're gonna share all our content over the Vascular online training. We can do the same for the materials that we have it on the Vascular online training and share it over the MOH. You know, we have the same objective. We are presenting the same vision, where we can actually help and make sure knowledge is distributed among different communities. We know in nowadays it's really hard for also the doctors to follow up and see what are the updates everywhere. It's going really fast everywhere, and they have their own daily practice in the clinics, or in their daily life, and we are trying to facilitate and make it much easier for them that they can watch or read or reach any kind of content at any time from their own couch at home. So I think it's all about, if we are sharing the same objective, so there is no limitation for us in collaboration.
Excellent, excellent, and I totally agree, and I am full force behind your brilliant ideas. It's also Vasca colleague asked me, do you have a mobile application they can join and follow you, or still it's only on the website?
Yeah, currently we are working in different solutions to make sure, as I said, the content is freely accessible and easily
Okay,
accessible.
okay,
In the future, we'll have different also materials and different source of materials that they can reach all our content. And yeah, I would also like to emphasize what we mentioned before, that it's really important for us to make it free to all the doctors
okay.
in the current situation nowadays, to make sure that everyone get the same fantastic opportunity to reach such content that we create with the experts like you and like all professors around the globe. This is actually really important for us, and I'm really happy to get this information and the question from your side. And this is something really much appreciated, because that helps us really to improve what we are going to offer to you, to the veno-lymphatic community, because as you said, it's actually a main objective for Sigvaris Group, not only to provide product solutions that can really help the patient to improve the outcomes from the treatment, but also to bring our competencies, to bring our knowledge and experience from different parts of the world to one bucket and make it available to everyone. And I'm sure you have seen during 2022 that we're collaborating with different big societies like the UIB, the biggest philology congress. We had done a really nice webinar prior to the event, just to make sure that we highlight the content of the event, highlight the speakers coming to the events, highlight the workshops. And this is not something really commercial at all. It's more about knowledge. And it's
Yes.
really important for some of the doctors who is going to attend such congresses to get a first hands-on what they're expecting in such a big congresses. UIB, not only the one, but also DGB, the Deutsche German Society for the policy in Hanover. We were also the partner of the online live streaming of the DGB, and
Yes.
it was really impressive to see people are really interested to know more. The same for the
Yes.
Egyptian Venus Forum. We're collaborating with the
Yes.
Egyptian Venus Forum, the EVC, the European Vascular Course, one of the
Yes.
most important course all over the year.
Yes.
And we have
Yes.
done the same, a pre-event webinars, bringing professors from the EVC or who is going to have a presentation or workshop to share with the audience what to expect in such an event. I think such a kind of collaboration also showing how we are really keen to deliver the right message to the veno-lymphatic community. We are now also collaborating with different platforms. Vascular online training, of course, on the top of that, but also ABC Vascular, who is also providing really nice courses, very,
Yeah.
very well prepared courses for diagnostic. Wand Masterclass, one of the really nice digital newsletters, was also
Yes.
providing hands-on, first hand-on on the studies. So we are trying to partner with so many societies and also platforms. So we are not seeing them as a competitor to us. It's always like a partner that we can really collaborate and bring something really different to the doctors in the vascular field.
uh, I always I always admire the medical knowledge pattern that Sigvaras follow, which is away from any marketing point of view. You just want to get knowledge, even if it is not related to your product, but it's related to your customer, which is a doctor. Want to have a good knowledge from the most eminent speaker in that field. We all really appreciate this. We also appreciate your presence in all our major congress. In all our congress, we have noticed both in the Middle East, in Egypt, in Germany, that you are always there. You are always helping hand to doctor. And this, we all agree, we have noticed, especially in the last 3 years, which was really remarkable. So you can count on vote. I should cross my hand, try to shake your hand to mention that we are dealing together hand in hand. We
Yeah,
have one aim. We just want to give knowledge to doctor. I'm
yeah,
sure the future will be fascinating working with you, Dr. Mahmoud. I'm sure also we can share a platform to discuss vascular cases among our customer, bring them all together in one unified platform. It's my pleasure to work with you, and
same
let us
here.
say this is the start of two teaching platform working together, and I'm
Exactly.
sure it will be successful. And if you want to add anything before ending this great discussion, tell me what is your mind or what you like to close up with.
Yeah, thanks so much, Professor Omar, for all what you said. I think as exactly, absolutely, we have the same goal, and I think we can really collaborate together. We have a lot of potential in both sides, and we can bring also the patient along with the same discussions to make sure that we really can improve the outcomes. It's as a whole community, our aim to create a point of connection at which we can share knowledge, as we care about not only patients around the world but also practitioners, as I said, different specialties. And of course, we would love to be part of all the events. Unfortunately, it's not the same situation every time with the congresses, but we are trying to work closely with you, that you are the expert, but also with the patient who is actually have needs, requirements, and we are trying to make sure that we provide the right solutions to all stakeholders. So thanks again so much for really the nice discussions. I really appreciate it. Learned a lot as usual. And as you said, it's just the beginning. So let us do it together. Thanks so
Yes.
much, Professor Aman.
Okay. Thank you very much, Dr. Mahmoud, and I wish you all the best.
Thanks so much.
Thank you.